What is a mini facelift and who is it best for? That's a good question. So a mini facelift is a procedure designed for patients that are showing just the earliest signs of lower face aging, which means just a little bit of jowling in this area, maybe a little bit of sag in the outer mid-face. It involves placing incisions in front of the ears, lifting up some skin, and some patients will need a little bit of skin lifting, some will need more. Then that layer underneath that area called the SMAS has sutures put in it, and the deep laxity is ever so slightly gently lifted and tightened, and then the excess skin is redraped, trimmed off, and closed with fine sutures. It's great to reset a face in which early jowling, early mid-face laxity is starting to show. In my practice, that's not how I do a mini facelift. A mini facelift for me happens to be a short scar deep plane facelift. And the reason I do that is because I believe that's the better reset to be done, especially when somebody is young, especially when their tissues are healthy with great elasticity. But again, you need to know that the younger you are, the less change you're going to get, because in most cases you haven't aged that much. But if the aging process is bothering you enough that you're like, hey doc, I'm interested in a mini facelift, in my practice you're going to get a proper deep plane facelift, only your scars are going to be limited to the front of your ears. That comes basically because I've been doing this for 22 years and I know how to use small scars to do aggressive operations. And I use the word aggressive appropriately. A deep plane facelift is not a small operation, but it is the operation that will reset your face the best, even if all you're worried about is a little bit of early jowling. But no mini facelift is going to adequately control for laxity or excess volume in the neck. For that, you're going to need neck-based procedures.